Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. Our contact number is 76967 34256. Contact us for the best OET coaching. And today we are doing reading part C. And we have already done a bit of questions of reading part A. There was one good question to learn from the reading part A, that in the blank, in the paragraph, it was given IV replacement of fluids are given in severe cases of diarrhea. And in the blank, I will show you. It's a good thing to learn. So I will also do that for you so that we don't miss out on that thing. This was a good thing that we were doing today. So in the line, it is given this. Yeah. IV replacement of fluids in severe cases. When we are filling the blank, question number 15, IV replacement of fluids are administered in case of severe diarrhea, then it is not making sense. So you have to delete two words. IV fluids are administered in case of severe. Now it makes sense. Severe word was the keyword. So it was given over here, severe. So IV replacement of fluids. And when I fit this word, IV replacement of fluids are administered. It is not making sense. So IV fluids are administered. So that is how you need to sometimes change. These are kind of tough questions. Only one or two of this kind can come. Max, otherwise not even two, one maximum to learn. Okay. Then we are doing this second question just for the part of convenience. The guidelines contains instruction for the staff. Now, please, as I always say, do not forget any of the grammatical things. Staff who. So they are talking about the staff. They are not talking about the patient. The guidelines contain instruction for staff who. So they are asking for the staff. Let's see what are the guidelines. Guidelines are for the MRSA. It may be necessary to screen the staff if there is an outbreak of MRSA within the ward. So if there is any outbreak of MRSA in the ward, then you have to screen the staff. So obviously I can say the staff working in the ward which has MRSA infection. Generally saying, first line also is one of my answers, that screen the staff if there is an outbreak of MRSA in the ward. So if I say the guidelines contain the instruction for the staff who is working in a ward which has MRSA outbreak. So this can also be the answer. But anyhow, let's go further. Results will be normally within 3 days. Occasionally done. Staff found to have MRSA will be given advice by the department. So second is staff having MRA. First, staff working in the ward having MRSA, staff found to have MRSA. So these are the people they are talking about. Even minor skin sepsis such as this and this can result in this. If a ward has an MRSA problem, staff with any of these conditions must contact. So again, staff having MRSA must contact so that they can be screened for MRSA carriage, so that the staff can be screened. Small cuts or abrasion must always be covered with the waterproof. Staff with infected lesion must not have direct contact. So they are talking, the overall paragraph is talking about the staff who might have MRSA infection. That's easy. That's easy. Now comes to the analytical thinking, how to match the options. Let's try to match the options. Okay. The guidelines contain instruction for the staff who need to screen the patient for MRSA. Nothing like this was given, that who need to screen MRSA patient. But again, don't overthink. For now, okay, you say 20% yes, but 80% no, because they were not talking about the staff who need to screen the patients for MRSA. The guidelines contain instruction for the staff who are likely to put patient at risk from MRSA. This can be my answer, because they were telling again and again the staff having MRSA should undergo investigation. Otherwise, they can spread. Like even in this, that even minor sepsis can widespread. That means they can spread it to other patients. And then they were saying small cuts and everything would be covered. So this can be one of the answers, because the staff who had themselves have MRSA can spread it to others. So this can be one of the answers. But again, not short, but again, elimination is definitely easy. If you will see, this is difficult. That is why I say this is difficult. But if you will normally See this paragraph, they are talking about the staff who can put the patient at risk. That is what they were talking about. So otherwise, elimination is easy. Staff who need to screen the patients, nothing like this is given. It may be necessary to screen the staff, not the patient. So screen word was given in the first line and they were talking about the screening of the staff, not the patient. So A eliminated. Easy. Intent to treat the patients who are infected with MRSA. In this whole thing, they did not talk about the staff who are trying to treat MRSA patient. Staff found to have MRSA, so they are not treating MRSA patient. Outbreak of MRSA within the ward, so they are not talking about patient again having MRSA. If a ward has an MRSA problem, staff with any of these conditions must contact. So again, they were not saying that staff who are intending to treat MRSA. They were saying if any department is having MRSA, then they were not specifically saying that patients having MRSA. So again, was a bit of tricky question because you might do C, but if you will read it again and again, you will realize that they are not talking about the patients having MRSA. They are just talking about the staff having MRSA, and these staffs can put the patient at risk. So they want to avoid that risk. That's the only point. Again, I will read it for you to make it clarified. It may be necessary to screen the staff if there is an outbreak. That means screening of the staff. So A answer is anyhow gone. Results will be normally available. Staff found to have MRSA. So not the patients. So patients are not having MRSA. Staff found to have MRSA. Even the minor sepsis in this, no, nothing about the patient was given. If a ward has an MRSA problem, staff with any of these conditions, again, they were not talking about treating MRSA patients. So there is no line that there's staff who intend to treat patients who are infected with MRSA. Nothing like this has been given. So it was very easy question, but yeah, C option can confuse you a little. But again, nothing like this has been given that patients having MRSA. So you can eliminate it. This is little hard to find otherwise if you do straight. That is where for the difficult question, I say this method elimination. Okay, let's see if the other questions are easy. I'm going to do the next question. Let's see if other question is easy. Okay, the main point. Obviously, I always say don't miss out these words. The main point. The main point of the notice is that hospital staff. Let's see what is the main point of the topic. Okay. Infection prevention. Infection control measures are intended to protect the patients, hospital workers, and others in the healthcare settings. Means in the healthcare settings, there are infection control measures to protect everybody. While infection prevention is most commonly associated with preventing HIV, these procedures also guard other bloodborne pathogens such as hepatitis B, syphilis. That means majorly the infection prevention is done for bloodborne viruses. They should be considered standard practice since an outbreak of enteric illness can easily occur in the crowded hospital. So in the crowded hospital, easy infection can occur. So to prevent it, bloodborne pathogens, infection control is important. So the main point until now, the main point is to prevent bloodborne infection. That is the main point from the first paragraph. Let's see the second paragraph. Infection prevention depends upon a system of practices in which all the bloods and body fluids, including the CSF sputum, are considered to be infectious. So all the fluids are considered infectious. All such fluids from all the people are treated with same degree of caution. So no judgment is required about the potential infectivity of a particular specimen. So basically they are talking about all the fluids should be considered equally infectious and all such fluids from all the people should be taken care of. Hand washing, use of barrier protection such as gloves, aprons, safe handling, cleaning, infection are all part of creating a safe hospital. So if I say the main point of the notice is that hospital staff need to be aware of the relative risk of various bodily fluids. It can be my answer easily because they were saying that it can cause risk and it can do this and that. Should regard all the body fluids at potentially infections. This was given. Yes, this was given that all such fluids, but this was only one line. The main point of the topic was again that prevent infection. Must review procedures for handling bodily fluids. I don't think this at. I'm confused between A and B. So in the exam, if I would be too much confused, I will do this question later on. But again, this can be the answer. Various bodily fluids. Uh, can you help me with this question? Please make sure that there is no background noises. I want to take your help. Are there various bodily fluids given? Anything like various bodily fluids?
No.
हाँ जी सर
Sorry. Anything like various bodily fluids?
हाँ जी सर ਸੈਕਿੰਡ ਪੈਰਾਗ੍ਰਾਫ ਦੇ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਸੀਗਾ in which all body and bodily fluids including cerebrospinal fluid sputum and semen are considered to be infectious.
I will read this line. Infection prevention depends upon a system in which all the bodily fluids, including this and this, should be considered infectious. So this line is going with this.
और सर कीवर्ड भी दिया हो ना पोटेंशियल इन्फेक्टिविटी
So I think
और जजमेंट
B is a very good answer, guys. Right, and all such fluids are treated with the same degree of caution and they require this and this. So B seems like a very good answer. And okay, relative word is given, relative risk. No, relative word is not given, I guess. They are saying all the fluids are same. They are not talking about the relative risk. They are saying all such fluids should be treated with the same degree of caution. That means all fluids should be taken same and relative risk should not be taken. Relative means that HIV is more dangerous, hepatitis is less dangerous. It should not be done. All the fluids are taken in the same way, so I would like to eliminate A as well. After talking to you, I feel like eliminating A. Earlier, I was not able to eliminate A, but this word is helping me. So answer should be B. The answer is given as B only.
यस सर
Yes, sir.
So a very good question to learn elimination, guys. See, earlier without taking your help, I was unable to do it. But this relative word means that HIV should be taken in a separate way. Hepatitis should be taken in a separate way. That we should take the relative risk. But in this line, they are saying all such fluids should be treated with same degree. So we should not go for relative risk. So then my answer becomes B. That is what happens in final OET exam. This gives you 100% surety elimination. So there is my elimination. Question number second was also fine. Question number second was also fine.
Yes, sir.
Again,
यस सर
in elimination, how intend to treat patients. Nothing like this has been given that patients are having MRSA. Need to screen patients, need to screen staff. Easy, or just do elimination. You will love it. It's just about, again, see, if you will listen to this video, you will forget it. If you will listen to this video 4 times, you will always remember elimination. Question can be done this way as well, but this is hard method. Elimination is easy. Need to screen patients, need to screen staff. Not matching. Elimination, how easy? In this question, if you will see, if I do not use elimination, I can't do this answer as B. But as soon as after talking to you, I saw the word relative risk. Relative means that two things are different, but they are saying it should be treated with same degree of caution. 100% B. This is what we want to learn. Okay, let's do one more question. Question number 4.
So question number 5, please.
4, 5, 6, we will do all. Please keep your mics on mute. I will do all the questions in the flow. What do nursing staff have to do? Simple. What is nursing staff needs to do? Extract insulin pumps. Many patients with the diabetes self-medicated using an insulin pump. So diabetes self-medicate with an insulin pump. If you are caring, you mean staff. My question is also staff. If you are caring for a hospitalized patient with an insulin pump, assess their ability to manage self-care. That means a nurse has to assess whether the patient can manage or not. So nurse has to assess whether the patient can manage. So first word that comes out for me is this. Underline these words, very important. Assess the ability of the patient. Patient using them must possess good diabetic. They must also have a willingness to monitor. My question is, what should nursing staff do? These two lines is, what should patient do? Patient using thumb must possess. So I don't care about these lines. They must also have willingness to monitor. So these lines are waste for me because this is what saves energy. My question is nursing staff. Besides assessing the patient's physical and mental status, review and record pumps specific information such as pumps make and model. So this should be done by the nurses. And I'm not sure about the one more line. Assess word is 100% nurses. This line, they must also have a willingness to monitor. So this can also be the nurses, recording, readings, assessing the patient physical and this thing, review and recording pump specific information. Also says the type of insulin being delivered and the date when the infusion site was changed. So nurse is recording all the information. Assess the patient level of consciousness as well and cognitive. If the patient does not seem competent to operate the device, notify the healthcare provider. So nursing staff train the patient how to control their condition with the use of insulin pump. I don't think so. They don't want to train the patient. I did not find anything. I find the word assess, assess, assess. So they are not talking about training. So this word is making me elimination. Determine whether the patient is capable of, yeah, this can be the answer. Determine whether the patient is capable or not. Evaluate the effectiveness of an insulin pump as a long-term means of treatment. They were talking about this effectiveness of insulin pump. This type of insulin pump, date. No, they were not talking about effectiveness. They were not talking about effectiveness, eh? This answer also seems like B. I don't know why. I'm not sure. Can you help me with the answer B or C?
Yes, sir. B.
Neither.
So again,
Yeah.
then it's fine. Then so it's easy, na guys. Again, why to overthink? They are not training the patient. They are not evaluating the effectiveness of a pump. Again, elimination is the easiest method. Yeah, matlab, this gives you confirmation. So again, let's do the next question. And in final exam, it will not take even seconds when you will do over here. I'm teaching you. That's why I'm taking time. Otherwise, in the final exam, it will not take even a second. Let's do one more question. The extract states that abnormalities in the babies born to mothers who take salbutamol are. Please read this again. When I read the question, this question is tough because there are too many words. So I have to read it again. But do not go to paragraph unless you do not understand the question. So I'm reading the paragraph again for you all. The extract states that abnormalities in the babies born to mothers who took salbutamol are. So the mothers who took salbutamol, pregnant mothers who took salbutamol, their babies may have the abnormalities. Let's see. Pregnant women. Salbutamol has been widespread. First line does not have my answer. However, there are no adequate or well-controlled studies. There is little published evidence. Does not have my answer. Administration of any drug to a pregnant woman should only be considered if the anticipated benefits, again, not my answer because I want the keyword babies. The extract states that abnormalities in the babies are. So my main thing is whether the abnormalities are more or less. That's the only question. During the worldwide marketing, rare cases of various congenital anomalies, including cleft lip, have been reported in the offspring of the patients being treated with salbutamol. So this is my line. So rare cases means relatively infrequent. Frequent means many. Frequent means often. It is opposite of rare. So infrequent means rare. Relatively infrequent means this. Easy. So answer should be this only. Again, the answer is A. Can you help me with this answer as well?
Yes, sir.
Yes.
Very simple, yeah. This is like very simple. Okay, let's do one more question. Last question. Final paragraph, in the final reading would be like this. It will hardly take 30 seconds or one minute if you will not overthink. Let's do the last question. Let's see how difficult it is. What is the purpose? When it comes to purpose, last two lines are very, first line and last two lines are very important. Purpose. First, so these are the lines for the purpose. always. Purpose means overall paragraph. Let's see. Debridement is the removal of the non-viable tissue. Sharp debridement is a very quick method, but only should be carried by a competent practitioner. So they are talking about sharp debridement. Autolytic debridement. Second is autolytic department. Should be used before other methods. Products that can be used autolytic are this. Hydrosurgery systems combine lavage with this and this can be used. This has been shown to precisely target this and this. Ultrasonic assisted debridement is relatively painless. So they are talking about third type of debridement. So first is sharp, second is autolytic, third is ultrasonic assistant, and it is very painless and has been effective. So they are talking about the advantages of all these methods. With earlier transition to secondary, however, the last two methods are potentially expensive. So till now, they were talking about the benefits. In the last line, they are talking about the bad effects as well. They are expensive and equipment might not be available. To present the advantages and disadvantages of particular procedure, yes, there are three procedures and they are talking about advantage and disadvantage. I think this should be right. To question the effectiveness of certain ways of removing non-viable tissue. To question the effectiveness of certain ways of removing non-viable tissue. Debridement is the non-viable tissue. Seems like a hard one, but it's easy again. Why to overthink? Advantage, yes. That they are quick method. In this, they were saying autolytic debridement, often used, effective technique, painless method. They were talking about advantage and disadvantage. And I don't want to overdo this question. But elimination, I am unable to. This question is tough. Sorry. But again, let's see option again. To question the effectiveness of certain ways. Are they talking about effectiveness? They are talking a sharp method. They are saying quick method. Can you please mute it? It's a tough question, guys. Please mute it. Ramandeep ma'am, it's coming from your mic. I have muted, please. See, in the first question, in the first paragraph, sharp method, it's a quick method. So they are not talking about effectiveness. Is often used before, can be used to facilitate autolytic debridement, hydrosurgery systems, safe and effective. This technique is effective. So in the second method, they are talking about effectiveness. Hard question, yeah. This is hard. To explain which methods are appropriate dealing with which types of wounds. Sharp can be carried out, may be appropriate for all the patients. This can also be the answer, which type of wounds. Product can be used to facilitate, auto can use other methods. Honey, hydrosurgery used in the ward environment. This has been used to precisely target. This is also about type of wounds. And ultrasonic assisted debridement is a relatively painless method, removing non-viable tissue. They are also talking about the type of wounds. But again, I was telling you now, the last line cannot be missed. Last line is very important. The last line is, if last line would not have been there, if last line would not have been there, my answer is 100% C. So if anybody of you have done C, take marks. But to be very honest, what I have learned from readings, when they talk about the purpose, last line is very important. They were talking about the advantage. The last line is talking about disadvantage. So A option is also a very strong option. Otherwise, if they would not have given the last line, then answer is 100% C. Sharp is used for all patients. This is used for reduced procedure time, damaged and necrotic tissue. And this one is used for removing non-viable tissue and effective in the bacterial burden. So otherwise answer should be C. So if you have done C, you can take marks. If you have done A, then in a way it is better because last line is talking about disadvantage. So both the options are equally correct. So if I talk now, see, this question should be done in second round. This question was easy, fifth was easy, fourth was easy, third was easy, second was easy, So obviously, two questions would be difficult. Sixth was difficult. First question, I don't know, but you have said that it is C. So if I am scoring 5 out of 6, I am okay. I don't care about the last question. Care about does not mean that I would do it wrong. I'm just saying that I will not waste my time. This is the way to do OET part B, and that too, don't give more than 10 minutes to reading part B. Please don't give more than 10 minutes to reading part B. Most important instruction. Now you can ask me anything before I switch off the recording. Okay. Any question, please?
So question number 9 ਦੱਸ ਦੋ ਕਿਵੇਂ ਕਰਨਾ?
We will talk about it, and please talk in English. Please talk in English. We will do question number 9 as well, but in part B, any question until now that you have not understood. That is the main point. See, doing many questions but not understanding is not good. Do less but understand more. Anything that you did not understand. Question number second was clear to everyone.
Yes.
Yes, sir.
So need to screen patients was not given. Need to screen staff. So words were not matching. Intent to treat patients were not given. So this was easy. Then in the third question, main point, when we came to this question, we learnt again this elimination. Relative risk was not given. Eliminated, this was not, must word was anyhow not given. Must to is a very important model for elimination. Question number fourth was again easy. Train word was not there. And effectiveness of the evaluation pump was not there. So again, eliminated. Easy question again. Fifth question again was not that difficult. It was given in the same line, the keywords. Mothers treated with salbutamol, offsprings had rare cases. Rare means relatively infrequent. This was also. So sixth question was hard. So even if it is wrong, that's okay. But even C seems like an answer. B seems like an answer. A also seems like an answer. Again, listen to this recording again and again. This is Dr. Bhupesh from Dr. BK Moit Institutes. Listen to it again and again. That's the only thing I can say. Do less, but do it multiple times to understand this elimination. Read it again. Read it again. Try to understand what I'm saying. Screen staff, screen patients. Words are not matching. You eliminate it. That's it. Okay, everyone? Done. I'm stopping the recording and then we'll talk to you guys. Thank you.